The People's Health Movement strongly condemns this month's attacks on the Palestinian people by Israeli occupying forces and expresses full and unequivocal solidarity with the Palestinian people. We condemn in the strongest possible terms the deliberate targeting by Israeli forces of hospitals, clinics, and other healthcare facilities in Gaza. At least 19 health facilities were severely damaged in the most recent violence, and 2 doctors were killed in their homes by Israeli airstrikes. These attacks have devastated a health system already overwhelmed by systemic challenges, including chronic shortages of medicines and supplies, weak infrastructure, and inadequate health worker capacity, all of which are exacerbated by a now 14-year-old blockade. These attacks risk exacerbating Gaza's COVID-19 epidemic. An Israeli airstrike on the Al-Ramal clinic forced the closure of Gaza's only COVID-19 laboratory, effectively halting the processing of tests in the territory. Amidst the shelling, 60,000 Gazans were displaced and forced into crowded shelters in which physical distancing is impossible. As an occupying power, Israel is required by the Geneva Conventions to provide healthcare, including vaccines, to the Palestinian people. As of May 15th, Israel had successfully provided at least a single dose of a COVID-19 vaccine to over 60% of its residents, while only 5% of Palestinians had received at least one shot. This is deplorable, it's inhumane, and it's an abdication of responsibility on the part of Israel. We demand the urgent provision of COVID-19 vaccines and treatments to the Palestinian people. We demand an end to the blockade and to the forced displacement of Palestinians from their homes and from their lands. The People's Health Movement believes that peace and justice are social determinants of health. We stand in solidarity with the Palestinian people. We cherish and salute their resistance and resilience.